In front of us, of course, we see the VetModal 850 microliter sperm separation device. But surrounding it, there are elements that are going to play an important role one way or another, so we should identify them now. It's important that we understand that the VetModal device is compatible with either raw or fresh semen and or previously frozen and thawed semen, depending on the circumstance. I have a cup of water to represent our fresh semen contribution, and I have a straw and a plunger to represent the circumstance we may be more used to with a previously frozen and thawed sample. Again, we will prepare the sample according to our protocol prior to loading the device, which we'll get into. Over here we have our media. Now the media plays an important role specifically as it relates to the heat source or incubation source that we're going to place the VetModal device within. And if it's a incubation source such as an incubator that is exposed to atmospheric air or a hot plate that has exposure to atmospheric air, we must use HEEPS or MOPS buffered media, essentially sperm wash. And the reason for this is to keep pH stable in these conditions. There are times and there are circumstances where we may only have access to an incubator that has CO2 or O2 or maybe nitrogen, a gassed incubator. And in these cases, we want to use bicarbonate buffered media for the same reason, to keep the pH stable. So identifying our media in advance is important. But I have a jar of HEEPS buffered media here because that is going to represent what seems to be most prevalent in a lot of cases. Over here we have 3 syringes. I've opened these in advance. They are 1 milliliter in volume, but specifically, and what matters most as it relates to the VetModal device, is the tip of these syringes. These are Luer slip tipped syringes, and that Luer slip tip is going to provide a very snug fit and tight seal whenever we are injecting into the device or aspirating from the device. This is important, as we'll see, and these syringes will work best. So we need 3 sterile syringes. Again, I've opened these in advance. Over here we have a petri dish, 90 millimeters in diameter. This will play an important role during the incubation phase of using the VetModal device. And then on either side of all of this, I have Eppendorf tubes. It doesn't have to be an Eppendorf tube. We're just looking for a safe place to store separated sperm, as we will need to at one point or another. And I have 2 of them because at some point we're going to employ the tube post-zymote, as we'll get into. But more than one is always good to have around just in case. It doesn't have to be an Eppendorf tube, but we're looking for something with a tight snap top or screw cap, ideally. And these are our elements with the addition of an incubator, which we do not see in the field here, but we can pretend is off to the side.